Today we're going to be talking about a really important and common issue that we see, and that's after you've had your knees replaced, one or both, how the heck do you get back to playing a game of golf? My name is Chris Finn. I'm the founder here at Par for Success. In addition to being a golf performance strength and conditioning specialist, I'm also a licensed physical therapist. So we deal with this all the time. And one of the first questions we ask is, which leg was it? So if you're standing over the golf ball, obviously I'm a right-handed player, so my right leg is going to be my trail side. My lead leg is my lead side. If you had your replacement on your trail side, that's the easier one to get back to playing the game of golf at a similar or hopefully better level than before you had the surgery. If you had the replacement on your lead leg, we have some other considerations that we want to chat about today. The big thing to think about with your knee replacement is before you get back to playing the game of golf, we need to make sure of three simple but critical things. The first is how well do you rotate into your left hip and into your lead, or so let's say your trail hip and your lead hip. For all you lefties out there, I apologize. We're just gonna call it trail and lead. We're not going right and left. So how well do you rotate into your trail leg and how well do you rotate into your lead leg? If you do not have the ability within the hips to internally rotate to the positions you need to get to, that is going to increase the stress on your newly replaced knee. That is a big boo-boo, big no-no. We do not want that to happen. The second thing we need to see, do you have the ability to rotate in the shoulder both ways as you come through as well? So as we're taking it back and as we're coming through, can you externally rotate your shoulder to get the club to where it needs to go? Because if you can't, you're going to try to get more turn from your knee, which is not supposed to be a rotational joint. It's supposed to go this way, and that's it. Okay? We don't want to be torquing the newly replaced knee. The third is going to be how well does your thoracic spine rotate. If you're limited in any of those three areas, there's going to be increased stress on your knee. You've just spent thousands of dollars to get a brand new joint or two. We want to make sure we're taking care of that. So actually in this, underneath this video, we have a link to our free home assessment. It's going to actually take you through how to assess those joints and a couple more actually for totally for free. I want to make sure that you are getting back to playing golf safely after your knee replacement. So grab that and then we'll continue on here in the video. So as you're thinking about getting back to playing, if it is your trail knee, the big concern you're going to have is how well are you able to post on that trail leg, okay? If your hip is mobile, your spine is mobile, your shoulder is mobile, we're able to get to where you need to get to, we should be able to avoid a good amount of sway. We should be able to post pretty well into this leg. As you're going through your rehab, you want to be thinking about kind of your golf swing. As you come back, the weight should be kind of on the big toe, kind of through the instep and into the heel. You should be on the inside of that trail leg. If you're not able to stabilize in through there, we're going to get a lot of swaying, and that's going to add more lateral stress on the knee that we really ideally don't want to see. We want good solid connection to the ground, rotating, that knee is nice and stable. The movement is coming from hip, spine, and shoulder, okay? If we're talking, let's talk more about the lead leg and if that's the knee that you had replaced. Because what we're going to see here, and we see this all the time, I'm standing on our dual force plates here from GASP, and what we see in all the data is after a knee replacement, if we look at pre-surgery, post-surgery, immediately post-surgery, we'll see that we actually are not, so if I had my knee replaced just, let's say, 12 weeks ago, as I come through, I'm not going to be able to push as much off of my lead leg. So my force production is going to be way down. So that's one of the things we want to think about in your rehab is really making sure we're giving you exercises that help to restore your ability to drive force in the ground and hopefully, honestly, increase it. And that's usually what we see by quite large amounts. So as you're thinking, the first thing is how well you're going to be able to push force into that lead leg. The second, how comfortable are you actually getting full weight coming to that lead leg? When we look at you swinging a golf club with 3D, the whole system on you here on our force plates, and we have our 3D kinematic system measuring you. Your hip is going to be moving 400-500 degrees per second. Your torso, your hands are coming like 2,000 degrees per second. That's a lot of speed coming through to that lead leg. And we got to make sure that you're actually comfortable stabilizing, decelerating, and posting and having good balance on that leg. And that all that rotational movement is not coming from the knee. It's coming from the hip, the spine, the shoulder, So that's when we think about your rehab exercises and getting back to playing. Unfortunately, in traditional physical therapy, you're not going to get into all of that. So that's where it's important to have a transitional program in place. So hopefully that helps to give you some things to think about, from knee replacements and trail leg versus lead leg. Like I said earlier in the video, grab the free assessment below and just take it, see how you do. You have to make sure that you are rotating in your hips, your spine, and your shoulders to keep stress off of those newly very valuable knees that you just spent a lot of money on. And if you are able to do that and your hip, everything is rotating well, you're going to play golf for a lot of years to come, pain-free. And we usually see at least 10 yards further off the tee post-rehab, if not more. So hopefully you see those results. Definitely grab that assessment below, and hopefully you found this video helpful.